SLAP. No, not that one. That one neither. I'm talking about your shoulder. So in today's Ortho Tuesday, we're talking about SLAP lesions. SLAP, S-L-A-P. That stands for superior labrum lesion from anterior to posterior. This is a labral lesion, a little bit different from that one we talked about last week. In fact, if you haven't watched last week's video, feel free to, either on Instagram or on our YouTube channel. By the way, if you haven't done yet, please subscribe. So this labrum lesion happens on the upper part of the labrum, different from when you dislocate your shoulder, that the lesion happens in the anterior inferior part of the labrum. We're going to take a look soon at some images and that will clarify. So the SLAP lesions happen mainly in throwers. So throwing athletes, the classic would be a baseball pitcher, but this could also happen in other sports such as tennis players, where you do the serving movement, that this can also happen, in water polo players, in volleyball players, and some other examples. This lesion happens due to the movement of the humeral head over the glenoid, and the labrum is forced to kind of unattach from the glenoid surface. So let's take a look at some images and hopefully this will clarify for you guys. Okay, so during a throw, we have 5 main stages, 6 if we count the wind-up also. So we have the early cocking, the late cocking, acceleration, deceleration, and follow-through. The SLAP lesion characteristically happens during the late cocking phase. That's when the shoulder has the maximum external rotation. So in these images, we see a left shoulder from a front view and here from a side view, but having the humeral head removed. So this is the glenoid, and around the glenoid we see the labrum. This image represents a SLAP lesion. That's when the upper part of the labrum is detached from the glenoid. This is another glenoid view with the labrum around it and the ligament capsule also attached. When we have a shoulder dislocation, usually the lesion happens in the lower anterior part of the labrum. When we're talking about a SLAP lesion, the lesion happens in the superior part of the labrum, and that's where the biceps tendon inserts. Now these images represent what happens to the shoulder during the late cocking phase of the throw. So this left side, this is a normal shoulder at rest, and this is during late cocking. So during late cocking, we have here the maximum external rotation of the humeral head, what dislocates the biceps tendon backward, and this forces the upper part of the labrum once it's pulled by the biceps tendon, and this can cause over time a detachment of the upper part of the labrum. Now here, last but not least, we see an MRI image of a right shoulder. This is a front view, and we see over here the humeral head, over here the glenoid, and now in blue we see the labrum detached from where it should be in the upper part of the glenoid. Now, talking about fixing the problem, these two images show two possibilities we have to treat a SLAP lesion. On this side, it shows that anchors were introduced and the labrum was repaired to its site. And then we count on the body healing for the labrum to scar. This other image shows a tenotomy. That is, the biceps tendon was cut off and that way it's not inserted anymore on the upper part of the labrum, and it was refixed in the upper part of the humeral head. So I guess many of you learned a new meaning for the word SLAP. Hope you've enjoyed today's Ortho Tuesday. Tomorrow we have Wednesday quiz. I'm Dr. Eric Curi. Thank you for your time and stay tuned for next week's Ortho Tuesday.